My pep talk today is entitled, What is Patient Empowerment? What is ROJoson Patient Empowerment Program? My empowerment objective is for the lay people to have an understanding of patient empowerment. What is it? Its benefits, why cultivate it, and what is ROJoson Patient Empowerment Program. I have a patient empowerment program since I started my private practice in 1982, when I would include detailed explanations of the patient's conditions and management, and also education and advice on restoration and maintenance of health. I reinforced it in 1989, meaning I tried to reach out to the public or lay people when I started my online writing under the theme of education for health development in the Philippines. I reinforced it further in 2011 when I started using the social media of Facebook to reach out to more people and patients. In 2020, I reinforced it further by making the patient empowerment program more structured with measurement of learning outcomes. I place an OLETE after a formal learning module. OLETE stands for Online Learning Cum Evaluation Test Exercise. Basically, OLETE is an online test and/or exercise that has for its objectives the simultaneous promotion of mastery of learning and evaluation of the learners or students. Since May 15 to 2021, I have added a ROJoson PEP Talk. This PEP Talk is designed to be a regular online or virtual talk by ROJoson on health concerns and issues. It is done on a once-a-week basis using the Zoom apps. The talk is limited to 1 hour with less than 20-minute talk, followed by 20-minute question and answers and interactions. The audience is usually limited to 15 to 20 persons for every session. The talk is accompanied by an online learning cum evaluation test exercise or OLETE after the session. Attendees who get the perfect score will be issued a certificate of commitment and accomplishment like this. After accumulating 50 such certificates in 50 PEP Talks, an attendee is entitled to a voucher for a free ROJoson Telemedical Consultation. This is the voucher. Thus, ROJoson Patient Empowerment Program is basically education of the public or lay people to enable them to take control in the management of their health, more specifically, to equip them with the basic knowledge, skill, and attitude to make educated, well-informed, rational, and cost-effective decisions on their health concerns. What is patient empowerment as defined by the World Health Organization or WHO or WHO and other organizations like the European Patient Forum? The WHO defined it as a process through which people gain greater control over decisions and actions affecting their health. It is a process in which patients understand their role, are given the knowledge and skills by their healthcare provider to perform a task in an environment that recognizes community and cultural differences and encourages patient participation. The European Patient Forum defines patient empowerment as the process that helps people gain control over their own lives and increases their capacity to act on issues that they themselves define as important. Thus, the WHO and the European Patient Forum have the same basic concepts of patient empowerment. There are other concepts that are related to patient empowerment, such as patient participation and patient-centeredness. Patient participation is a strategy to achieve patient-centered care, and a patient-centered approach leads to patient empowerment. Patient-centered care management is the practice of caring for patients and their relatives in ways that are meaningful and valuable to the individual patient. It includes listening to, informing, and involving patients in their care. The Institute of Medicine defines patient care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. In patient-centered care, an individual's specific health needs and desired health outcomes are the driving force behind all healthcare decisions and quality measurements. Patients are partners with their healthcare providers, and providers treat patients not only from the clinical perspective, but also from an emotional, mental, spiritual, social, and financial perspective. So with the above explanation, it can be concluded that patient empowerment is a much broader concept than just patient participation and patient-centeredness. Patient participation is a strategy to achieve patient-centered care, and a patient-centered approach leads to patient empowerment. What are the benefits of patient empowerment as forwarded by WHO and other organizations? 1. Improvement in quality in healthcare administered by physicians and other healthcare professionals because of patient-centered care. 2. Improvement in health outcomes because of patient participation. And 3. Control of medical cost because of patient-centered care and patient participation. In short, the application of the concepts of patient empowerment, patient participation, and patient-centeredness can lead to a better and cost-effective quality care and a better and cost-effective quality of life. Why is there a need for patient empowerment program aside from the need for patient participation and patient-centered care? Medicine is an inexact science which contributes to a lot of uncertainties and confusions in physicians' management and patients' decision-making on what to do for their health. The treatment of a patient is dependent on the mindset of the physician, the mindset of the patient, and the mindset of the patient's relatives. Although in the end, it will be the patients who should be deciding, a lot of times they are influenced by the mindsets of the physicians. Physicians have variable mindsets. It is practically impossible to have a uniformity of mindset of the physicians everywhere, anywhere, all over the country, and all over the world because of the different medical education systems and teaching and different values and cultures, etc. To be patient-centered, to save the patients from the confusing management of the physicians, one has to resort to patient empowerment program, the goal of which is to develop a process through which patients or people are enabled to gain greater control over decisions and actions affecting their health. Furthermore, in the light of the ever-confusing medical information and also confusing health professionals, a patient empowerment program is needed to equip the lay people or patients with at least the basic knowledge, skill, and attitude to make educated, well-informed, rational, and cost-effective decisions on the health concerns. So takeaway in this pep talk, concept of patient empowerment, okay, based on the WHO concept, it is a process through which people gain control, greater control over decisions and actions affecting their health. It is a process in which patients understand the role, are given the knowledge and skills by their healthcare provider to perform a task in an environment that recognizes community and cultural differences and encourages patient participation. Benefits of patient empowerment: improvement in quality in healthcare administered by physicians and other healthcare professionals because of patient-centered care, improvement in health outcomes because of patient participation, control of medical cost because of patient-centered care and patient participation, the need for a patient empowerment program in the light of ever-confusing medical information and also confusing health professionals. A patient empowerment program is needed to equip the lay people or patients with at least the basic knowledge, skill, and attitude to make educated, well-informed, rational, and cost-effective decisions on the health concerns. Patient Empowerment Program of ROJoson. This is basically an education of the public or lay people to enable them to take control in the management of their health, more specifically, to equip them with the basic knowledge, skills, and attitude to make educated, well-informed, rational, and cost-effective decisions on their health concerns. Patient Empowerment Program in Tagalog, I'd like to propose this: pagpapalakas ng pasyente. Pagpapalakas encompasses the following concepts: karapatan, knowing your rights as a patient; responsibilidad, responsibilities in empowering yourself by cultivating competencies to manage your rights and your health concerns and issues through the following: kaalaman and kakayahan, meaning knowledge and capability, and makapagdesisyon para sa kanyang kalusugan or self-determination. I end this pep talk. I hope I have empowered you to have an understanding of patient empowerment. What is it? Its benefits, why cultivate it, and what is ROJoson Patient Empowerment Program. Mabuhay kayong lahat.